Thanks for watching Afternoon Live. Every day there's something new we learn about the coronavirus, and here to give us the latest COVID-19 update is cardiologist and researcher Dr. Ernst von Schwarz is with us today. Dr. Ernst, good to have you on the show again. I love your updates.
Oh, thank you, Kara. Thanks for having me on again.
It's crazy to think there just keeps on coming more and more questions because there's more and more surges going on out there. We're in our fourth. It seems like that's going to be happening in Oregon. And, with the vaccination continuing, it's just a little worrisome.
Yeah, that's right. And I guess I have less answers to your questions because there's so much unknowns. If you look at the numbers in the U.S., there were yesterday like 80,000 or 81,000 new cases documented. This is actually 20,000 more than a week ago on a daily average. So in some states, we see a surge right now, even though where I am in California, the numbers are going down. We had 2,500 new cases today, which is less than in the last days.
I think some of the worrisome part, too, is that you see in certain states, they'll say, oh, we had a certain 100 people of, who have the coronavirus now, some even hospitalized and have been vaccinated. And looking at those numbers, it's hard to decipher if they had the virus from before. I mean, how are you reading all of that?
Yeah, that's right. So, overall in the hospital, it's much more quiet than in the last weeks or, of course, a few months ago. So we still have COVID patients in the intensive care units on a ventilator right now. But overall, the admission rates of COVID infection, of new COVID infection, has gone dramatically down, which is a good thing for all of us. So now we have a wider variety of intensive care patients caused by other diseases rather than COVID. On the other hand, we are a little concerned. There are three reasons why we are concerned now. One is, of course, we have a couple of new variants, and I'm sure you are aware of those. And we really don't know what their transmissibility is and if they cause more severe disease. The next concern we have is that several states are reducing the mask mandates, and the social distancing measures are much less strict in many areas right now. And we don't know what that leads to in the near future. And the third thing, which nobody talks about is that there is more and more vaccination hesitancy. So in rural areas, we have heard just as of yesterday that approximately 20% of adults do not want to get vaccinated. So I think we have a lot to do with regard to educating our population how important it is. And it's definitely less dangerous to get a vaccine than getting COVID.
Talk about this vaccine, too. You need the 2 doses. There's a local woman who accidentally got 1 dose of Pfizer and 1 dose of Moderna. I mean, is that a danger? And do you need to be on top of, exactly at that 3-week or that 4-week mark, you have to, no matter what, get in on this certain day to make sure you get that second dose?
Depends who you ask, Kara, but the answer to that is absolutely not. In Europe, for example, because of the concerns of the AstraZeneca affiliation, the vaccine affiliation with the development of clots, some countries recommend, for example, if you get the first dose of AstraZeneca, there's nothing wrong with getting the second dose of Moderna or the Pfizer-BioNTech. So, of course, we try to adhere to the initial recommendations to stay on the first dose for your second vaccination. But is there a possibility to switch or to have a variation? Absolutely. Whatever you get will give you some degree of protection, ideally within 2 weeks after the second dose.
Share a little bit about this COVID double mutation risk, what it is, what we need to be concerned about.
Well, the double mutation or super mutation was first detected or reported at least in a variant from India, and several cases have been reported. Even in the U.S. and in Northern California and the San Francisco Bay Area, at least 5 cases have been reported being infected with that mutant. It's not clear at this point what it really means long-term, if it's causing a more severe disease or not. We also don't know at this point if the vaccines are effective against those double variants. The most prominent strain right now in the US is actually the UK version, the B.1.1.7. And it seems that all available and FDA-approved vaccines in the US, Johnson & Johnson, Moderna, and Pfizer-BioNTech, seem to have efficacy against that strain.
Fantastic news. Thank you, Dr. Ernst. Appreciate it.
Thank you for having me.
And we're going to have more information about this segment on our website at KATU.com. Don't go anywhere. Afternoon Live will be right back.